This segment is sponsored by ARA Diagnostic Imaging.
Welcome back to We Are Austin. Lung cancer is the deadliest type of cancer in the U.S. And unfortunately, most times people get very sick before they really figure out the problem. Dr. John Williams with ARA Diagnostic Imaging shares what you need to know to help catch cancer early, which is really the key, isn't it?
It is. It really is. You know, screening is the key to a lot of these tests. It gives treatment the best chance of working. And,
wow.
And so this is a relatively new arena for us. In the past, well, first of all, it's an important disease process to address because lung cancer still accounts, it's the #1 leading cause of cancer-related deaths in the United States every year in men and women, and that includes up to 150,000 people who's come to lung cancer every year. And part of that is because we haven't done a great job in the past of being able to identify it in its early form and find the lung nodules when they're small and when therapy will be more effective. I think a good comparison is breast cancer. So that's actually a more commonly diagnosed form of cancer, but fortunately it's much further down the list of mortality or people who die related to, and that's because there are good treatments, but because there's also a really good screening tool, which is mammography, and so we're able to catch that disease process early, you know, and affect treatment outcomes. And so in the past with lung cancer, we've kind of relied primarily on chest x-rays, which is a good tool, but it has it's not as good at catching the nodules when they're small, and when, you know, the treatment will be more effective. We end up kind of catching them when they're later. The disease process is more advanced, and you know, so therefore the treatments are not as good.
Limited, yeah.
This examination, CT lung screening, when applied in, you know, the appropriate population, can actually reduce lung cancer-related deaths by up to 20%, which is, you know, significant.
That's significant. It truly is. Yeah. Who is a good candidate for a CT lung screening? Who should really be keeping an eye out for this?
So it's effectively very heavy smokers. Lung cancer in general, greater than 90% of all people diagnosed with lung cancer have a history of smoking. But this is even a cohort within that is basically people who have what's called a 30-pack year history of use, which is a way of describing that they have smoked the equivalent of a pack of cigarettes a day for every day of their life for 30 years, so it's a lot. And then they're between the ages of 55 and about 77, and they're continue to smoke, or they've only stopped smoking within the past 15 years. So within that group of people, that's where we see that significant reduction.
And you're looking here at the traditional chest x-ray, which you mentioned before, which just doesn't quite do as much as the CT.
And we still use it all the time, and it's sort of the bread and butter for pneumonia and that kind of stuff, and we can see you know, lung nodules on there, but you'll see the comparison with this is a CAT scan, and so, you know, same sort of plane, but you just get a lot more detail, so it makes it much easier for us to be able to discern the smaller nodules.
Yeah, for instance.
And then this is just an example of, you know, a relatively large one, but, you know, they really stand out on this modality and help us detect cancer.
You can see the difference there, and smokers really are the people who really should be paying attention for the CT. Is there anybody else who should be thinking about this?
So that's a good question, because it sounds like, you know, such a great test, why doesn't everyone get it? And studies have shown, though, that because not every lung nodule that we see is cancer, it's not a good test to apply to just the general population. We'd end up with a lot of false positives, and so it's really best applied just in that subset of heavy smokers.
Yeah, that's very, very important to know, and that is you're looking at a slide here of that group who should really be paying attention to this.
Exactly.
If you really want to know how to learn more about this CT lung scan, if you do feel like you fall within that high-risk group, what should we do?
So, you know, have a conversation with your healthcare provider. You know, I confirm that you're in that group that would benefit, and then you basically get a referral to have this examination done. We suggest having it done at a facility that's been accredited as a lung cancer screening facility by the American College of Radiology, and that's because those facilities are able to not only perform the test, but they have to meet certain requirements to be able to do the necessary follow-up. So we identify these nodules, and then we can't just, you know, let these findings kind of go unchecked. We need to follow up on them, maybe get a biopsy, get it kind of to the next level of care.
And people often do talk about radiation. There may be concerns when people are hearing about the CT lung scan. What are the concerns there?
Sure, we do hear about that. part of our job as radiologists is to always basically minimize the dose of radiation that you receive while still having a diagnostic examination.
Yeah.
And so this CT is about a third of the dose of a regular chest CT.
There you go.
And that's because it is a screening examination, so we anticipate people have several over the course of their life. So we have to be more aware of the kind of the cumulative doses.
Very, very good to know. This is important information. Early detection sounds like it truly is key to saving lives.
It really is.
Now, how can
Absolutely.
we learn a little bit more, and where can we go for more information?
So we have a lot of information actually on our website, osrad.com, or give us a call, Austin Radiological Association.
Excellent. This has been really important information. Thanks for joining us. It's great to see you.
Thanks for having me.
Happy holidays.
Good to see you.
Thank you very
You
much.
too.